My name is Karen Raby, and I'm the Senior Project Manager for Telehealth. And with me today, we have Chelsea Witness, who is a Senior EHR Support Analyst, and Heather Johnson, who is a Consulting Provider Solution Specialist. Over the next few minutes, we're going to talk about Mission Health, how Mission Health is focused on providing care from everywhere with Amazon Web Services and Cerner. So today we will talk about who is Mission Health and the Telehealth Department, industry challenges, solution overviews, and the benefits that we got from partnering with Amazon Web Services and Cerner. So I'll give a quick overview of the North Carolina division of Mission Hospital. We have 6 acute care hospitals. They are located regionally around North Carolina. Mission Hospital is the hub hospital, and it's located in Buncombe County, which it's centrally located with the 5 regional hospitals around us in rural areas. We have 56 locations and 128 clinics that include primary care, specialty care, and urgent care. We have post-acute services, which are inpatient rehab, LTAC, outpatient rehab services, and hospice and home health. We have an extensive provider network with around 1,100 providers that are either employed or affiliated with the hospital. And we have key essential services, which include a level 2 trauma center, we have a comprehensive stroke center, we have level 4 NICU, among others. There's several others that we also have. And we have virtual care, which is hospital-based, clinic-based, and we have an asynchronous direct-to-consumer program. The Mission Telehealth Department has 10 years experience in developing and implementing telehealth solutions in Western North Carolina. We also have programs. We have programs that are in stroke, behavioral health, psychiatry, and infectious disease, and hospitalist, among others. We have more than 20 programs in 9 hospitals and 15 clinics. In 2019, we went from 20,000 telehealth visits to 50,000 in 2020. We have an asynchronous direct-to-consumer virtual clinic. The department structure is set up so that it is dedicated to telehealth. We have a telehealth director. We also have a senior project manager, which is me, and we have a coordinator. And that helps us so that we're not just implementing telehealth, we're implementing programs and that are sustainable and keep going. We are also connected to HCA telehealth programs, which helps us scale expertise, providers, and solutions quickly. So when we first started looking at a telehealth solution, we were looking at the hospital's overall strategy and what would best fit with Mission Hospital. So we wanted to align telehealth with the hospital system growth plan. We didn't want to have a loss in revenue. We wanted to increase pre- and post-surgical visits because they were bundled services and we didn't have to worry about that loss in revenue because at the time we didn't have any reimbursement from insurance companies. We wanted to improve care, which would be a reduce in no-shows and reduce the loss to follow-up. And we wanted to increase our access points. We wanted to eliminate the travel barriers because we have so many patients that are traveling from outside the region in our rural areas to try to get specialist care. And we wanted to increase our portal utilization. So we looked at Cerner Video Visit because it had the scheduling solution. It had a quick implementation. It was cost effective. So we thought it was the best fit for Mission Hospital. I will hand that talk over to Heather so she can provide an overview of industry challenges.
We're now reviewing with you the industry challenges that COVID-19 presented, as I'm sure many of us in healthcare are aware of. COVID presented a need to pivot quickly from in-person visits to telehealth. And some of our practices were not already on telehealth services just yet. So there was definitely a quick change to get them acquainted with that technology, the workflow, etc. When the COVID guidelines came out, there were also ability for healthcare providers to use any different kind of tools, such as Zoom, Doxy.me, FaceTime, etc. And it really presented a saturation of those tools, which really kind of made it difficult for Mission to troubleshoot with the different end users and different practices based on the application that they were using at that time. So Mission really helped provide and push practices to a standard tool, which was Cerner, being that is it was integrated within the application that they were using every day while in clinic. During the industry challenges as well, we learned about new coding and documentation changes, and that required a lot of discussion on a almost daily basis to review what those coding guidelines are and update our EMR to include the new codes, to include the documentation elements that the providers and the practices needed to utilize, etc. We do in Western North Carolina have a lot of rural health areas that do lack internet services or good broadband to connect to video. So we did have some challenges in those areas with the video visits, and it required our providers and staff to connect with the patient only by phone. Additionally, we have interpreter services that that was a challenge of how to get them integrated into the video with the staff or with the patient and the staff, the providers that are treating that patient. And we're still navigating through that as we integrate more and more with telehealth services. Now I'll pass it to Chelsea to talk about the implementation.
So as Heather mentioned, we had to quickly pivot due to the COVID-19 pandemic. So what we did was we did a mass implementation across primary care and specialty clinics over 3 weeks. We had a structured project plan that included 333 provider schedules, 3 registration and scheduling applications, 88 locations, and 4 appointment types. We standardized the appointment types and the visit duration. And then we also had integration with the appointment reminders and the patient portal invitations so that no one had to manually send those. So the great thing about the Cerner and Amazon integration is that it is an integrated platform for all. It meets every party where they are. It allows the clinicians to join from the electronic medical record. It allows the patients to join from their patient portal. It has the capacity for multiple participants. It's multimodal in the sense that it allows patients to join from their mobile device or their desktop, and it's fully automated that allows no one to step outside of their workflow or have any manual intervention. Now I'm going to pass it off to Heather to talk about the benefits of moving to the AWS platform.
So prior to integrating with AWS, we were on another vendor platform. When we transitioned to AWS, we saw a lot of benefits that we'll be reviewing with you. One of the biggest ones that we experienced was the removal of the app requirements for patients. So prior to, they were getting confused because they would receive a link to join, and the inability to join without the app was something that our providers and our clinics, mostly our support staff for our providers, were spending a lot of time with patients to explain that they needed to navigate to the app to launch their video from there. So we really saw increased additions to the patients joining the videos without staff reviewing what needed to occur because the app was no longer a requirement. Additionally, with the transition to AWS, we saw a lot of benefits with the face-up peripherals. So prior to, we had to spend a lot of time troubleshooting with providers, patients, and users on their technical issues that they may be experiencing with their cameras or their microphones, etc. And they're not as equipped to know how to navigate behind the scenes to make those switches. So when we integrated with AWS, it put those peripherals face up for the users. It was a huge benefit because it allowed the patient, the provider, whomever's joining the video to select their camera, to select their microphone, their speaker, and validate that all of them work before they even join the video. So that was a huge win when everyone joined the video prior to AWS. There was a lot of issues with maybe not seeing a video or not hearing sound, and that has really decreased with this enhancement. Additionally, we saw faster and reliable connection. A lot of our patients were getting dropped or unable to connect. And as referenced earlier, we do have a lot of rural health areas or a lot of rural health in this area. So we actually even saw a bit of an increase with rural health connectivity as well, with the more faster, reliable connection with AWS. And then lastly, we didn't have any backend tools previously that allowed us to really kind of troubleshoot what the patient or end user was experiencing. So with this transition to AWS, it created visibility and accessibility to really kind of hone in and troubleshoot what the provider or the patient was expressing as an error, and being able to look behind the scenes and see what may have caused that to occur. In this slide, as you can see, when we converted in July, the number of video visits completed in Cerner with the Amazon integration increased roughly by 10%. So we had a higher success rate with the video visits and connectivity with our patients and our providers. Now I'll pass it to Chelsea to close us out.
So with the partnership of Cerner and Amazon Web Services, we were able to provide a personalized healthcare experience for our patients, including connectivity, automation, devices, and accessibility. Thank you.